Hi, I'm Marty Jolly, Director of Nursing from Dakota Abilities. Let's go through how to care for a person's ostomy. You're going to support people with ostomies, and you do not have to be med certified to help the person with that care. So let's go ahead and learn how to do that. First thing you want to do is gather all your supplies and perform hand hygiene, okay? I don't have a sink. If I had a sink, I would be washing my hands with warm water and soap for 20 seconds, but instead I'm going to just get a good-sized dollop of hand sanitizer in my hand. I'm going to rub that very thoroughly all over my hands until it's completely dry. Once it's completely dry, I'm going to go ahead and put my gloves on. Before I replace an ostomy, I want to go ahead and empty the old one and remove it, okay? So in order to empty it, I'm going to need a graduated cylinder to dump any of the contents into. I'm going to want some wipes to cleanse the site once I close the bag. So let's go ahead. All right, I'm going to go ahead and replace your ostomy and drain the bag. So I'm going to get the clothing removed to the point of what I need to see, but I also want to keep the person's warmth in mind while I'm doing this. I'm going to go ahead and grab my graduated cylinder and a wet wipe to drain what's currently in the bag. So I'm going to come over to the bag, and this is kind of a Velcro, and I'm just going to peel that back, and then I'm going to release it. I'm going to go ahead and drain the contents that are currently in the bag. So I'm just putting my graduated cylinder off to the side, and I'm going to push everything that's in the bag out and into my container. Then I can go ahead and take my wipe, and I'm going to wipe along the end of the bag where it seals, and I can go ahead and seal that back up. So I'm just going to flip that back until I get it closed. And you want to make sure you're really pressing into it, kind of like a Glad Seal bag, to get it really sealed up. Okay, so I've emptied it. Now I'm going to be ready to go ahead and remove this one and replace it with the next one. Let's look at some of the supplies that we can use. First of all, when you notice a person's ostomy bag, at the top you're going to see that there's a little window. If a person's bag has this little window that's a different color, that is a filter. It's a charcoal filter that's in the bag that allows air to flow out of the bag so that the bag doesn't become too full and explode. So if they have a charcoal filter, you shouldn't have to worry about gas building up to the point where it will explode the bag. And the charcoal filter, the purpose of that is to reduce the smell so that you can't smell the gas while it's coming out of the bag. If a person doesn't have a charcoal filter on their bag and you notice that they have trouble with their bag exploding or getting too full due to gas, let us know and we can try to get the physician to switch them to the bag with the charcoal filter. Then on the back side of the bag, you're going to see the ring where the bag seals to the wafer. So the bag is basically the holding tank for the contents of the GI tract to come out and sit in until we empty it into a container and dump it into the toilet. So holding tank is what the bag is. This is called a wafer. The purpose of the wafer is just a connection point to that person's body so the bag can be connected. So we need a way for that holding tank to connect with the person's body. That's the purpose of what they call the wafer. And these two just come together by literally snapping together. The ring snaps all the way around and seals, and then there wouldn't be any drainage coming out of it once you've got it snapped all the way around. So there, I've got those snapped together now. Once I remove the adhesive off the back and attach it to the body, any contents that are coming out of that GI tract will come into the bag on the outside of the body where I can then easily drain it. Typically, once we do a replacement of this, it's going to be 3 to 5 days before we have to replace it again. The only time I'm going to replace it in between there or more often is if it happens to break the seal around the site and the stool is coming out, then we would go ahead and replace it at that point. And that would be considered PRN or as needed replacement of that ostomy wafer and bag. Okay? So if at any point that wafer that has that, basically that adhesive backing disconnects from the body and stool is leaking out, then we're going to go ahead and replace the whole system like I'm going to teach you to do today. Other options that we have when dealing with ostomies are things like different wax rings or wax pieces. And the purpose of those, when you think of them, they're kind of a little bit like modeling clay. And you can take those out of their packaging. They've got this releasable paper on each side, and then it's a really pliable material and very sticky. And the purpose of this is if a person happens to have a divot where their ostomy is placed, so say their ostomy is right near their belly button, I can actually do a buildup of this material or this wax ring in the belly button so that we have a flat surface to put the ostomy wafer on. We want it to be a flat surface. So we're gonna place some sort of wax ring or wax, or also we have Adapt paste. And Adapt paste is a really thick paste that can go onto the body. And the purpose of this paste is to fill any holes as well. So if the person's body had a divot in it that I needed to fill, I could simply put the paste along that divot. Once I had that filled, then I would be able to go ahead and place the wafer over it. So that I've placed right there will help fill that hole so that I can put the wafer down and get a good seal around the ostomy site. So basically just hole fillers or divot fillers so that I have an even surface when I go to place the wafer down. The paste is very sticky, so it's not something that's moldable in your hands. You're not going to be able to make a ball of this and use it to fill a hole. The paste, you're just putting into wherever the divot is. So if the divot was in the belly button, then I'm going to take the paste and fill right at the belly button site, but I'm not going to be able to move it around. It'll just stick to my fingers. It's going to be one of the wax rings or wax strips if I want something that's pliable that I'm going to mold into the shape that I want. So the paste is going to be to fill, and I'm not going to be changing its shape with my hands. The wax rings or the wax strips, I can move around kind of like clay with my hands and fill into the space in the way that I need to. Next, we have scissors that we use for an ostomy, and the scissors are actually curved. So if a person has an ostomy site where we have to actually cut the wafer to fit around their ostomy, then we use the rounded scissors and we actually take them and cut on the back of the wafer. So in this example, the wafer has measurements all along the back. So on one side, we've got millimeter measurements, and on the other side, we've got inch measurements. So if that person's ostomy is 1 1/4 inches, I'm gonna go to the next line past 1 1/4, and I'm going to trim around that wafer to get to that 1 1/4. Another product that you'll frequently see with a person's ostomy supplies that will be sent to them without us even having to request it is ostomy powder, okay? So it's called Adapt powder. People get confused about this powder and think that they should be using it whenever they're doing a change to a wafer at a person's ostomy site, but that's incorrect. The only time we're gonna use Adapt powder is if that person has some sort of open area where we're gonna place that wafer that has some sort of drainage or is moist. So the purpose of this is to dry that enough where we can place the wafer on top of it. So if there's a situation where I needed to use this powder, it would be where the skin was kind of, where we've got drainage and it's a little bit moist around this site. This would be an example of when I would want to use the powder. But if the tissue looked like this, regular tissue that's intact, I'm not going to use that powder when I do that change. The other thing to know is when I use the powder, I'm going to place it around the area where the moisture is, and I'm going to spread it out. I'm going to let it just kind of soak up that drainage. And once it's all spread out around the site, then I would be able to go ahead and place the wafer over that site. I don't want to have a ton of this, just enough, and I can brush away any excess that's on there, because it's not going to help it stick if I have too much of that Adapt powder when I go to put it on there. So just a light dusting over it, all it's doing is soaking up some of that moisture so that the wafer can adhere to the skin. Let's go ahead and remove the old wafer now. What I'm going to use is an adhesive remover wipe. This is really important because it's going to allow me to get that adhesive that's stuck to that person's abdomen to release with ease so that I don't damage that person's tissue on their abdomen in the process. We need that tissue to stay intact because we've got to put another wafer back on it when we're done. So I open up the little adhesive remover wipe, and I'm just going to get a little corner of this wafer, and I'm going to start pulling it back, and then I'm going to go back and forth with my wipe until I've got this pulled away. Okay, so I'm just going to keep working my way all the way around this site with the wipe, slowly pulling it away, not damaging the skin while I'm doing it, just moving to different parts and continuing to move forward with that, slowly removing. Now I'm going to come over here, slowly remove, just letting the wipe do the majority of the work for me. The pull away, once I've used the wipe, is very simple. It's not taking a lot of pressure. If the person has any signs of discomfort or if they're struggling with it, certainly stop while you're in that process and give them a minute to kind of get recomposed and then start again. If your wipe loses its moisture, then just go ahead and grab another one and start over with the next wipe. So you're just going to keep doing that all the way around until we've got that wafer all the way off. I want to be going slow enough where I'm not causing any pain or any damage to the tissue, but also I know that this person doesn't want to go through this process forever, so I don't want to be at a turtle's pace either. Okay, so just keep removing. There we go. Okay, then I can pull the entire thing off, and this is going to go in the garbage. I'm done with this, okay? Then I'm going to go ahead and take a cleansing wipe, and I just want to cleanse the areas all the way around the site. I want to get it clean so that when I come to adhere to it, I've gotten all the adhesive off. I can see there's a little bit of that left, so I can go ahead and get any of the remaining adhesive off and then cleanse the area. And once I've got all the adhesive off the site, and now I'm going to go ahead and I'm just going to pat dry the tissue around there. I want it to be dry before I place the new wafer on top. Okay? Next, we're just going to move on and we're going to get the wafer. So this individual has a pre-sized wafer that's correct for their ostomy. Okay? So I'm not even going to have to do any cutting on the back of this wafer. It's ready to just place on. So once this site is sealed, if the person has any sort of skin prep that helps to protect the skin or anything, that's when you would want to apply that. Like some people will have a Cavalon skin prep, and sometimes it's just a little wipe that you would be applying or a spray that you would apply around. Just make sure if there's any sort of other prep that you're putting around, you're never putting it onto the ostomy itself. Nothing should go onto the ostomy. The only place that we're putting any sort of stuff is the skin surrounding it. I'm never putting the stoma powder onto the ostomy. The stoma powder is merely going to the damaged skin around it, but never onto the ostomy itself. Okay, so I've cleansed my site. It's ready to go. I'm going to go ahead, and the first thing I'm going to do is separate on the back of the wafer. I've got basically this clear, transparent, protective layer. Just going to peel that away. Now, I'm going to go and fit this gently over the ostomy into place. Once I've got it into place, I want to seal it around using my fingertips, and I'm just going to get a good seal all the way around. Then I'm going to take the wings off the back of the wafer. So the wings are just a piece of paper and you merely pull that away and then you're going to flatten that down. You're going to do the same thing on the other side. You're going to go ahead, pull that paper off, put that down. Now is the point where I like to take my hands and put them over the site and hold them there for a good 30 to 60 seconds. The warmth from my hands is going to help the wafer seal to the person's body. If you have a person that also has extenders, and the extenders, the purpose of these is some people have trouble with the ostomy, the adhesive staying on their body. So they'll use an extender as an extra adhesive to keep it down so they don't have leakage, so that they can make the wafer and the bag last as long as possible. If a person has an extender, the extender's like everything else with ostomies. There's a sticky side, so I'm going to pull away the paper that's connected to the sticky side. I'm just going to slowly, gently remove that. Now I've got this ring, and basically this ring is going to go out over the corner and provide added stability to this to help it stay down on the site. And I would take the next extender and apply it to the other side. The extender feels a little bit like clay or some sort of moldable, the same way the wax rings do. And I'm just going to get that placed right around where I can, based on their anatomy, to help this seal and keep this item in place for me. Okay. So I'm sticking that down. Now I'm going to hold my hands over this for 30 to 60 seconds as well, because the same way that my hands are getting the ring of the wafer itself attached, they're also, the warmth from my hands is helping the extenders get a good seal to the body. Everything that I'm doing right now is what's going to help this wafer stay in place so that I don't have to change it as often, and so that I don't have to deal with leaks. Got this sealed. I'm going to go ahead and I'm going to take the bag that fits with this wafer, and I'm going to go ahead and pinch it onto the site so that I have it sealed all the way around. And I like to just double check that, going back over it, making sure I've got a good seal. Then you want to make sure that the other end you have properly sealed as well. Now I've changed it and I can clean up anything else that I need to, throw away my supplies, and I'm out the door. Thanks for watching.